Yo, what up, a-holes? Thank you for tuning into the Holistic A-Hole podcast. My name is Erik Levi, and I'm the Holistic A-Hole, the mommy blogger with balls, the inconvenient truth of health. What's up, everybody? Thanks so much for tuning into this follow-up podcast here, the second part of us talking about my biggest gripe with public health insurance and the current healthcare or health insurance model. So if this is the first podcast you're tuning in and you're like, what the hell is going on here? You just jumped into a middle of a double Dutch fucking jump rope situation here. Does that make sense? You just jumped right in the middle of a conversation. So to get yourself caught up, what you want to do is actually listen to the podcast from Monday, where I started this podcast off talking about healthcare and health insurance and my problem with the idea of A, Obamacare, and B, of mandatory health insurance and universal healthcare and free healthcare. So if you're new to the podcast and you haven't listened to that episode, make sure you listen to that one and then come back and listen to this one. So without wasting any more time, the reason I wanted to do this podcast in the first place is because a month ago I got into an argument, a discussion, a debate, somewhere in between all three of those, with some dude here in New York City in Washington Square Park. I have a podcast all about it. It is appropriately called What I Learned Arguing with Hypocrite Liberals, or something like that. This guy, if you remember from that podcast, made a point, I'm pretty sure I mentioned it, about health insurance, because we were getting this argument, and I was like, well, why do you, can you tell me why? Because this guy was very anti-Donald Trump. In fact, he was selling like all of these, fucking liberal anti-Trump pins in Washington Square Park, and I found them to be quite offensive. I don't get offended easily. I'm a comedian. I have a pretty dark sense of humor. It takes a lot I get more offended by just dumb fucking people doing dumb shit. And this guy selling these pins, with like talking about Trump supporters are Nazis and white supremacists and whatever. And I found it to be ironic that the typical liberal speaking point is that Republicans are capitalists and Nazis and they want to hold the little man down. Meanwhile, you got some asshole here charging money for basically hate speech of people who support Donald Trump. Okay, so again, if you don't have no idea what I'm talking about, go listen to that podcast. Also, it's from like a month ago, middle of September 2018 sometime. And one thing that we were talking about was health insurance. And I asked this guy, I'm like, well, what is one of your biggest problems with Trump? And he was like, Trump, Trump's getting rid of Obamacare, and he doesn't believe that everybody should have health insurance, and, people are going to die without Obamacare. And, I was like, I just was like, that's just not true. That's just not factual at all. In fact, under Obamacare, healthcare coverage raised. It all raised. It all got exponentially higher. Everything became more expensive. Pharmaceutical companies made way more money. Most of the healthcare industry grew by, tens and hundreds of millions, maybe even tens of billions of dollars in the 8 years that Obama was in office. And nobody got healthier. Obesity rates rose. Diabetes rates rose. Cancer rates rose. Every fucking health statistic of disease rose under Obamacare. So clearly Obamacare is not working, okay? And, then there's this argument because, well, you have all these uninsured people who keep getting sick. Again, not true at all. One thing that he said to me that is what really set me off is, he said, well, healthcare costs are rising because all of the uninsured people are going to the emergency room, and they're clogging up the emergency room so that the people who actually have the health insurance coverage are being denied care in the emergency room. And I was like, I know I've heard that before, and I just never really thought about it, but for whatever reason, this guy said it, and it made me want to research it. And now I know why he said it, because I've heard it before, and it's actually been uttered by former President Obama himself, okay? The quote is, which I'm sure wasn't the only one, but this is the one that I found on the Washington Post, no less, which owned by Jeff Bezos. Not a big fan of the Trump movement, but here's the quote from President Obama in 2016. A lot of sick a lot of people just didn't bother getting health insurance at all. And when they got sick, they'd have to go to the emergency room. But the emergency room is the most expensive place to get care. And because you weren't insured, the hospital would have to give you the free health care. And they would have to then make up for those costs by charging everybody else more money. That was my Obama impression, by the way, if you were wondering. Damn, is Obama on the podcast now? Is Erik interviewing the former president, President Obama? No, that was just me. I was just that good. Basically, what Obama is saying is that the reason healthcare costs are going up is because a lot of the sick people who don't have insurance, instead of going to the doctor, are now just going to the emergency room. Okay. And it was interesting because I started looking at this CDC report that was released in 2016, probably around the time when Obama gave this talk. No, this came out in 2017, so just a little bit after. And the statistics that the CDC presents don't support that statement at all. Even the Washington Post came out and they quote, this is a quote by Catherine Baker, who is the dean of the University of Chicago's Harris School of Public Policy, right? Which is University of Chicago, one of like the top 2 or 3 business schools in the whole country, okay? This is her quote. "It would be nice if giving people insurance did get them so healthy and so much access to other care that they didn't need to go to the emergency department, but that does not seem to be the case. It seems clear to me that expanding insurance in and of itself does not contain spending. It increases spending by giving people who had very limited access to care the ability to get their health care needs met." So basically what she's saying is that this idea that, that all of these people who didn't pay for health insurance are now just using the emergency room as their primary care provider. And the evidence, again, from like the CDC and several other studies just don't support it. In fact, the people who use the emergency room the most are people with Medicaid. Yeah, people with Medicaid. And you know what Medicaid is? That is government supplied health insurance. They're the ones who are going to the emergency room. People who don't have health insurance, in fact, go just about the same to the emergency room, maybe even a little less than people who have private health coverage. So, and it's also a very, very small number of people, okay? It's like less than 20% of emergency room visits are utilized by people who don't have health insurance, okay? So what you're saying is completely false. When you use this line that, the people who don't have health insurance are the ones who are driving healthcare coverage up, it's absolutely not true, and it's totally a discriminatory thing to say, because what you're doing is you're putting all of this blame on the people who are just saying, look, I would rather take my own responsibility of my own health care and figure the shit out on my own. And, if I do get sick, I'll live with it. I'll figure it out. I'll make some green tea. I'll drink some orange juice. I'll eat some chicken noodle soup. I'll, do what the holistic a-hole advises, which is to, eat more lemons, eat the white shit underneath the lemon fruit, make some bone broth soup, eat some good red meat, rest, sleep, rehab my adrenal fatigue. This is what people without health insurance are doing. People without health insurance are actually probably the most educated people on health issues because they have to actually do it themselves, right? It's like if you are the type of person who likes to work on cars and you are like, fuck the mechanic's charging me $1,500 for a little gauge, a little valve to put in my engine when I can go to AutoZone and buy that thing for $15. Okay? I'm unfortunately the one who has to go to the mechanic because I don't know shit about cars, but I know about my goddamn body, and I know that I don't need to pay $700, $800 a month to avoid the sniffles. Okay? And if I do get sick, like if I get like a serious infection, like if I get a staph infection, or if I get hit by a fucking bus, I'll go to the emergency room, right? Like anybody would. And I'll pay the shit out of pocket. Because I have the money, because I haven't been paying it all through this rip-off sick care health insurance system, right? So every time these people, when you're having these debates about health insurance and somebody hits you with that line like, oh, it's all the uninsured people using all the emergency room capacity, hit them with this fucking stat. In fact, I'm going to put the URLs to the article I just mentioned and to the CDC's report in 2016 that talk about this, so you can see this for yourself, right? So you know that the holistic a-hole ain't playing you. I would never play you a-holes. I love you a-holes, and I care about you, and I want you to make the right decisions when it comes to your healthcare. And I don't want you to get, run through by these, fucking idiots who think that everybody should have health insurance because somehow health insurance equates health care, which equates being healthy. Look at the statistics. It's absolutely not true. So that's really all I got to say about that, you guys. Like I said, this is going to be a short and sweet episode. I hope you loved it. If you're new, make sure you subscribe to the podcast. If you did love it, it really helps me out a lot if you just go on to iTunes or do this right in your phone or your iPad. Just go on to Apple Podcasts, leave the podcast a 5-star review, say what you love about it, and then join the Holistic A-Holes Facebook group, like the Holistic A-Hole on Facebook, the Holistic A-Hole Facebook page, and then follow Holistic A-Hole on Instagram, Twitter, and YouTube, all Holistic A-Hole. And if you have any comments about the show, make sure you go to the group, leave them there, or shoot me an email, holistic.a.hole@gmail.com. I'll catch you all in the next one. Peace.